Can you see the screen?
Yeah.
Okay, I think this is the last station. We have total 20 questions.
Can I take first 6 questions or 7?
Okay,
Then in EU, then Dr. Amir.
okay, no problem. You can read the station. No STEM actually, directly at the started question. What is jaundice?
Yellow coloration of skin and skin tissue and body fluid due to increased bilirubin in blood. Hello.
Yes. Then next, why patient with
Okay.
GIST might present with jaundice?
Okay. Biliary obstruction around the ampulla of Vater from tumor compression or metastasis to liver or use a hepatotoxic imatinib in treatment. Okay.
What is
What
GIST?
what is okay. Uh, gastrointestinal stromal tumor, a type of cancer that begins in GI tract, arise mainly in stomach and small intestine, arise from intestinal cell of Castle found in the gastrointestinal muscularis propria.
Okay, how does it differ from gastric carcinoma?
Okay. Uh, Gastric ulcer. Gist arise from mesenchymal origin from intestinal casal cell. In gastric carcinoma, arise from epithelial cell. Gastrointestinal stromal tumor commonly metastasize by blood, rarely by lymph node. Gastrointestinal carcinoma commonly spread by lymph node.
Okay.
Okay, next question.
Clinical presentation.
Okay. Symptoms according to location. Asymptomatic, like asymptomatic abdominal discomfort, nausea and vomiting, weight loss, GI bleeding, jaundice, dysphagia, early satiety.
Patient presented with jaundice few months later. Why?
Okay. Biliary obstruction from tumor compression metastasized to liver or use imatinib in treatment.
Okay. Function of bile.
You take this station, please.
Function of bile will be emulsification of fat, and it increases the surface area for the pancreatic enzyme. How does bile salt help in emulsification of fat? Bile salt has one hydrophobic part and hydrophilic part, and bile salt aggregate around the a lipid droplet. Usually its hydrophobic part remains towards the lipid droplet and hydrophilic parts remains the outside. So these hydrophilic part are negatively charged, And when
The
this
hydrophobic is
hydrophilic hydrophilic part is
yeah.
negatively,
Are you sure?
yeah, hydrophilic part are negatively charged and hydrophobic is positively charged. So hydrophobic part remains inside the lipid droplet, towards the lipid droplet, and the hydro, because it remains in the blood, right? And blood is like water soluble. That's why this hydrophilic, which remains in the blood, and a hydrophobic part, it is positively charged and it is fat.
No, মনে হয়
I think it is like, I remember it.
hydrophilic, hydrophilic or hydrophobic.
Phobic means phobia or the fear. So hydrophilic part,
Yes, yes, you are right. You are right.
yeah,
Continue.
hydrophilic remains in the outside, which is negatively charged. So negative charge, they prevent aggregation of the fat particle. This is how they remains like the single particle. Otherwise, they will form a big particle, and it will be difficult to in digestion and metabolism. This is how bile salt helps in emulsification of fat.
What is bilirubin conjugated to?
Uh, it is conjugated with glucuronic acid by a enzyme called glucuronyl transferase.
Okay. Bilirubin metabolism.
Okay, bilirubin metabolism. Uh, bile, a bilirubin is conjugated in the liver by glucuronyl transferase, and then it is secreted with the bile, and it enter into the second part of the duodenum. In the small intestine, uh, uh, this conjugated bilirubin will not be absorbed, and it will enter into the large intestine, but the bile acid, mostly it will be reabsorbed into enterohepatic circulation. Then in the large intestine, there will be uh, uh, gut bacteria which will deconjugate the bilirubin, and it will form urobilinogen. Then this 50% of this urobilinogen will be oxidized by the bacteria, and it will form stercobilin, which forms the brown color of the stool, and remaining 50% of urobilinogen will be reabsorbed. Then from the reabsorbed urobilinogen, some part will undergo enterohepatic circulation, and remaining part will enter into the renal system or in the kidney, and it will be excreted through the urine. As that is why it will form the yellow color of the urine.
Okay.
Okay.
What is urobilinogen and how is it formed?
Urobilinogen is a product of bilirubin metabolism, and it has no color, and it is formed by the uh, uh, gut flora from deconjugation of the conjugated bilirubin.
Uh, a mass had been found. How to diagnose it?
Okay, we can diagnose it by uh, CT abdomen with contrast, and we can do endoscopy with biopsy, and we can go for histopathology, also immunohistochemistry.
Okay. What is series 117. How to detect it?
It is a protein which is tyrosine kinase receptor protein, and it remains in the membrane.
Okay. What other cell that shows CD1 117 positive?
Other cell like mast cell, melanocyte, and hematopoietic stem cell.
Okay. Management.
Okay, Dr. Amir, you can start from here last.
Okay. Management of this case, it depends on the clinical picture of the patient. If he is asymptomatic and mostly will be less than 2 centimeter, we'll go for conservative treatment with advice of regular endoscopy for surveillance.
Mhm.
If the patient is symptomatic, we'll go for surgery, and we can add to the treatment also, like we said, tyrosine kinase inhibitors like imitinib.
Okay. What is the value of CD117 in treatment?
Uh, yes, if the tumor is CD 117 positive, it means that this tumor will respond uh, uh, nicely to the treatment tyrosine kinase inhibitor, which is imitinib.
Okay. What is Helicobacter pylori? Which part of stomach usually affected?
Helicobacter pylori, it's a gram-negative uh, microaerophilic flagellated bacteria. It is found in the antrum of the stomach.
Uh, what cancer other than adenoma does Helicobacter pylori cause?
It causes mucosal-associated lymphoid tumor or maltoma.
Okay. Cause of vitamin B12 deficiency.
Vitamin B12 deficiency. We have the inflammatory bowel diseases that will cause or affect the terminal ileum, and this will cause deficiency of intrinsic factor, which is important for the absorption of vitamin B12. We have any gastric tumors also, or gastric surgeries. We have malnutrition and patients on TBN. That's what
Oh,
I
other causes of macrocytosis.
causes of macrocytosis. We have alcoholism, we have pernicious anemia, we have hypothyroidism. We have also intestinal or ileum, chronic ileum disease or inflammatory bowel disease or ileal resection. That's it.
Okay. Thank you.
You have
Okay.
anything to add here?
No, brother, you answered very nicely. Nothing to add. So, with the mercy of
Mm,
Almighty, we finished pathology.
yeah.
I don't know how much
Tomorrow schedule.
will remain in our brain, but we wish again we will give a very rapid revision. Very rapid.
Yeah.
Uh,